During pregnancy, the umbilical cord functions as a lifeline between mother and child. The umbilical cord not only supports your unborn child in the womb, but can now support your child after birth. Once considered a biological waste product, umbilical cord blood has emerged as a viable source of adult stem cells. What are adult stem cells and why are they important? Cord blood contains a number of different types of stem cells, each with different properties. Currently, the most important stem cell in cord blood is hematopoietic stem cells. Hematopoietic stem cells are primarily responsible for replenishing blood and regenerating the immune system, and have the unique ability to differentiate into different types of cells. Hematopoietic stem cells are found in bone marrow, peripheral blood, which is the blood currently circulating through your body, and umbilical cord blood. Since cord blood stem cells are collected at the earliest stage of life, they are young cells and very potent. They have had less time to acquire damage from environmental factors, such as radiation and chemicals. The most common use of cord blood at the moment is for hematopoietic stem cell transplants. Over 15,000 have been performed around the world. Increasingly, scientists are looking at ways to make use of cord blood for uses in other diseases such as cerebral palsy, spinal cord injury, juvenile diabetes, and multiple sclerosis. Why should I consider storing my baby's cord blood? There are many reasons why you might consider storing your baby's cord blood. Banking your baby's stem cells ensure that those cells will be available for your child in the future. Collection of your baby's cord blood for their own use is referred to as autologous collection, and the cells are, of course, a perfect genetic match for your child. Making the decision to store your baby's cord blood is really a decision about the future. Storing your child's cord blood is an investment for your family, similar to health insurance. We hope you never have cause to use it, but in the event you do, it's peace of mind knowing you have. How do we collect cord blood? Collecting cord blood is actually very quick and simple, and more importantly, pain-free for the donor. After birth, the cord is simply clamped, cut, and the cord blood is drained into a collection bag. The collected cord blood is carefully packaged into the specialised collection pack and transported by a dedicated medical courier directly to the laboratory for processing. The cord blood is separated into plasma, red cells and white cells. It's the white cells which contain the precious stem cells. A controlled specialised process is used to gradually bring the cells down to the appropriate temperature of -100 degrees Celsius, ready for cryogenic preservation and storage. Public awareness is minimal, and Australian Stem Cell Healthcare see it as part of our responsibility to help educate and raise awareness of the advantages of storing cord blood.
Umbilical cord blood contains unique stem cells which can be collected and stored without the physical risk of harvesting from adult bone marrow or the ethical issues associated with embryonic stem cell collection.
Stem cell researcher Professor Mark Kirkland is with us to detail the process, uses and benefits, and Susan Miller joins us to explain why she chose to store her children's cord blood. Good morning.
Good morning. Let's talk about embryonic stem cells versus these stem cells that we can find in cord blood. We know that the cord blood ones are much easier to access, aren't they?
And, of course, totally non-controversial.
Yes.
They otherwise go in the bin, basically.
And that's what used to happen, didn't it? You would take the whole umbilical cord and placenta and it was all binned.
In the bin.
Is it a difficult process to collect it and store it?
No, it's no different than taking blood out of the vein, really. Once the baby's born and the cord's been cut, you clamp the cord and you're waiting for the third stage of labour. You just basically clean up the cord and put in a needle and it drains into a bag.
Whose blood is it? Is it the mother's blood or is it the baby's blood?
It's the baby's.
Why is it better than... What properties does it have? Why is it different to normal blood?
Well, I don't know why it happens, but it seems that around the time of birth, the baby mobilises a lot of stem cells. Now, you can argue that maybe this is because it's to protect it against injury or provide a repair kit, because effectively that's what umbilical cord blood is. It's a little repair kit It contains a whole pile of different cells that have got enormous potential in the future.
And basically those stem cells, just to explain to people who don't understand it, that the stem cells are unique because they can become any other cell in the body, can't they?
Well, there's different types of stem cells in cord blood. So there's one type that has been used for a number of years since the early 90s for treating diseases like leukemia and so forth. And that's what's licensed for use now. That's what's available for use now. That's what public banks do. But there are other stem cells in there, and those stem cells have all sorts of other properties. So, for example, there's a stem cell called an undifferentiated stem cell, and Professor Bob Williamson at Murdoch Cancer Institute is looking at the ability of those cells to turn into lung cells for treating diseases like cystic fibrosis in the future.
The science of stem cells is advancing rapidly. It is worth considering some worldwide statistics. 1 in 250 people are diagnosed with type 1 diabetes. 1 in 500 suffer from cerebral palsy. The largest cord blood company in the US reported 1 in 2,500 stored cord blood samples have already been used to date. With scientific advances, this figure is expected to increase. It's important to plan. Do your research, get the facts, and make an informed decision.
West Australian mother Barbara Ayling has had first-hand experience of the medical fraternity's mixed feelings towards cord blood collection. She has cerebral palsy, one of the conditions scientists hope could one day be treated using stem cells. Before giving birth earlier this year, Barbara Ayling decided she wanted her daughter's cord blood privately banked.
I thought, well, in 19 years' time we won't know what they might be able to do. And as long as you can store it, then you have that option.
2 GPs at the practice Barbara went to agreed to take the cord blood, and they received training packages on how to do it.
But when Barbara Ayling went into labour on a weekend, a different doctor was on duty at her regional hospital and he refused to carry out the procedure. The Aylings say they would have hired a private technician if they'd known, but have now missed their chance.
It's a choice that I have the right to make. I mean, apart from anything else, I'm spending a phenomenal amount of money to do this. I've made a very informed decision, and I would like that to have been more respected.